Our group assignment that we did is on family child health nursing in regards to cystic fibrosis, created by Amanda Ruiz.
Christopher Mendez.
Crystal Fernandez.
Joe Meneses.
Marietta Havakimian.
Nancy Joy.
And Rose Hernandez.
For this assignment, our group will be exploring family child health nursing, incorporating the nursing assessment with interventions and outcomes for the Smith family. The youngest daughter of the family, Sarah Smith, was diagnosed with cystic fibrosis during her newborn screening. Cystic fibrosis is the most common chronic, progressive, and fatal genetic disease in white children. CHF results in abnormal secretions and thick mucus obstructing glands and ducts, seriously affecting the pulmonary, gastrointestinal, endocrine, metabolic, and reproductive system. The Calgary Family Assessment Model was used to assess the Smith family dynamic and structure. I will be going over internal, external, and context structure. The first is internal structure. The Smith family is a nuclear family made up of a father, mother, and 2 daughters. Victor Smith is a 30-year-old male that is married to Olivia Smith, a 29-year-old female. They have a 3-year-old daughter named Jenny and a daughter named Sarah, who is 4 months old. The Smiths have subsystems, which are small groups the family has relations with, made up of extended family members and a set of close family friends that are also neighbors. There are personal, clear boundaries that are set, but with Sarah's illness, the Smith family has become more dependent on their family and friends for support. Next is external structure. Extended family is made up of 2 sets of grandparents that live in the same city who are very active in the children's lives. Also, close family friends who are neighbors are made up of a husband, wife, and young son. The larger systems the Smith family is involved with are community outreach programs such as sports, committees, and fundraising for events. The Smith family is also active in their church community. Last is context structure. The Smith family is a white American family from the middle working class. Victor works as a supervisor for a major retail company, while Olivia works as a first grade teacher. They practice the Christian religion, and they live in a residential community within commuting distance from the city.
The bioecological systems theory combines the developmental theory with the systems theory to understand the individual and the growth of the family, with genetics and social characteristics in this development. Individual development is affected by 5 levels of environmental systems. The microsystem consists of the family unit. Here we have mom, dad, father, a 3-year-old girl, and then Sarah, who's 4 months old, that is recently diagnosed with cystic fibrosis. The mesosystem includes close family members and neighborhood friends, preschools, daycares that the kids may attend, and the family is very active in their community church. The exosystem is the fact that the father and the mother are middle working class family. They both work full time. The extended family of the grandparents that live in the same city and the participation in their outreach programs. The macro system, they're a white American middle class family with a Christian religion. And the chronosystem is a diagnosis of the cystic fibrosis and the gradual changes in the health of the family that they will experience in the future as the disease affects Sarah. The chronic illness framework is a conceptual framework to help foster and understand how chronic illness affects families. It has 3 elements to it. The illness type, the Smith family is facing a gradual, progressive, unpredictable chronic illness, and it will change over time and progress as symptoms progress and eventually be fatal. The time phase, they're in the initial phase of this disease process, and they will be gathering information on cystic fibrosis and begin establishing work relationships with healthcare providers. They have potential for stress and may not accept the diagnosis. They may also ask for a second opinion. And the family functioning phase of this framework is that they are going to adjust to the needs of Sarah as the demands of the illness progress. The nurse should provide education and integrate medical treatment, as well as discuss further potential decisions that they may have to make based on Sarah's health declining.
So first we have the genogram. The genogram basically consists of Sarah's familiar relations and possible sources of support. So the eco-map. In the middle of the eco-map is Sarah's family, and on the outside there are circles which help represent external forces that help influence the family. So the arrows kind of show the relationship between the families and whether or not these are strong or weak relationships. This kind of helps the family evaluate which sources are actually available, both positive and negative, to help the family. So functions and tasks. Functions and tasks of the family. So they're in the starting phase of Sarah's illness. So one of the main things the family has to do is to find a facility that specializes in the care of children with CF, because not all hospitals specialize in that. They also need to secure a pulmonologist to follow Sarah's progress. It is necessary that Victor and Olivia understand the disease process of Sarah and what to expect developmentally and physically. And then they also need emotional stability within the family. And it's necessary to keep a normal family structure and try to keep things as normal as possible, as well as promote the family's health. So transitions come with coming to terms with Sarah's diagnosis. Both the parents need to understand that they're not having a normal, healthy child, and they must understand what they're going to expect developmentally and on the future. It's also necessary to figure out if one of the family members are able to move to a hospital that specializes with children with CF, if one of the parents is able to leave their jobs or take time off their jobs to help take care of her when she's having acute illnesses related to CF, and to see whether or not possibly a daycare or schools that will help specialize with children with CF as well.
In the article by Fridas et al. 2015, 2 standard postural drainage outcomes were compared to identify the technique that's safer and results in fewer GERD episodes in infants from 3 to 34 months. The authors compared standard postural drainage greater 30 to 45 degrees head down tilt and lesser 15 to 20 degrees head down tilt with modified postural drainage greater 30 degrees head up tilt or lesser 15 to 20 degrees head up tilt. Chest physiotherapy, particularly postural drainage, is used in patients with cystic fibrosis to clear the airway and improve lung function. However, it is associated with exacerbation of GERD, putting the patient at risk for aspiration or reflex bronchospasm, as well as further impairment of pulmonary function. Although the evidence provided is weak in the review, the authors note that compared with 30 degrees head down tilt position, 30 degrees head up tilt technique is associated with lesser GERD episodes and respiratory complications on a long-term basis. Chest physiotherapy alone or in combination with exercise has been widely used as an adjunct therapy in treatment of cystic fibrosis in people of any age, contributing to improved survival. Possible outcomes. Following the recommended 30 degrees head up tilt standard postural drainage technique, the baby will be experiencing lesser GERD episodes and will be at a lesser risk for aspiration. Per Mayo Clinic, the treatment for cystic fibrosis may be the following: medication regimen, complications, chest physical therapy, West therapy, pulmonary rehabilitation, surgical, and other procedures. Lifestyle modifications would include hand hygiene, exercise, and diet. The dietary recommendations were to exclusively breastfeed for up to 6 months. Some formula-fed babies may require a special high-protein, high-energy formula. Also consume extra 120 to 150% of the daily recommended intake of calories per day, with 40% of the calories coming from fat. Food rich in vitamin D, long-chain fatty acids, which is known also as omega-3, and you can find omega-3 in tuna, sardines, pilchard, mackerels, salmon, nuts, and peanuts. A diet with a wide range of foods high in monosaturated and polysaturated fats, full-fat dairy products, and also follow physician's order if high salt intake is recommended. Possible outcomes. The family is more knowledgeable regarding the disease, infection prevention, nutrition, signs and symptoms to report.
So for the Smith family, I think it's important to consider the family system theory, goals and goals and outcomes should be geared towards treatment management and surveillance, family coping, functioning, family stability, and improved communications. Assessment, assess family members' perception of the problem. Understanding family perception of the problems can lead to clarification and facilitate problem solving. Assess strength, coping skills, and current support system. This helps facilitate the use of previously used successful strategies. Assess developmental level of family members. Some family members may have difficulty understanding the demands of family members with cystic fibrosis. It is really important to explore their understanding of the disease process. Everyone has different maturity and developmental level. Also consider family values, beliefs, and cultural factors. In some cultures, male, the head of the family makes a decision about healthcare. Also consider cultural health practices, offer support and guidance to decision making. Peer review interventions. The goal, self-care. The goal of self-support is to enable patients and families to perform 3 self-tasks. This includes medical management, carrying out normal roles, function and activities, and managing the emotional impact of their condition. Cognitive behavioral intervention is to improve adherence. The aim is to provide psychological and physical well-being of the individual with cystic fibrosis and their families. The study shows that adherence to prescribed treatment regimen is one of the most challenging aspects of managing cystic fibrosis, and parents often feel critically responsible for ensuring these treatments are performed on a daily basis. The other intervention is massage therapy. Evidence shows that massage therapy improves pulmonary functions and decreases parents' and children's anxiety. And other interventions provide opportunities to express concern, explore feelings, empathize with other family members, set realistic goals. I think it's really important. Offer resources that are offered in the community, such as cell phone hotlines, help groups, recovery centers, and educational opportunities.
So acute stressors and diagnosis, focusing on the diagnosis since Sarah was recently diagnosed. So the family may experience grief due to the loss of a healthy baby, and they may have some anxiety about the uncertainty of the prognosis and course of CF that Sarah will have. And also the family will experience some stress about the perceived losses due to Sarah's illness and the adjustments that they'll have to make in their family routines, especially since both parents work full-time and they're involved in their church. And since CF is transmitted genetically, the parents may feel feelings of guilt, helplessness, and fear. And some of the chronic stressors that the family may experience is ongoing and anticipated grief for the eventual loss of the child. And then also the daily management, the day-to-day management of strict treatment regimen that would include chest physiotherapy, medications, and the dietary requirements. And also just the illness is a constant in the life of the family. So the family just having to reprioritize and prioritize the care of Sarah in the family dynamic. And then just also changes in the family dynamics since the parents will probably have less time with each other and also the other daughter. And the role strain that the parents may experience between the general kind of parental tasks and role and with the addition of the caregiving role to Sarah. And also the increasingly frequent hospitalizations from possible exacerbations, and what goes along with that is the fear of the child's exposure to infection and medical procedures and pain that Sarah might undergo. And then finally, the psychological impact of the illness on the child and family members, since kids with CF are more likely to experience anxiety and depression.
Okay, so the implications for family nursing practice. So for patients that have chronic illness and experience chronic illness throughout their life, it's going to be a great cost for the family. So if this family is spending $250 per doctor's visit or for different types of treatment, it's going to feel like a big burden. So this also affects patients that have a client that has a low socioeconomic class, so it's going to be an even bigger price for them. So for many of these patients, we have to focus on basically normalizing their stages of development because their children won't be developing the same as other kids. So it's important to communicate to the parents that their child is going to be reaching certain developmental milestones at different times, but it's going to be more individualized to the patient itself. So some research right now into family nursing practice. Basically, the current trends show that there's a very low adherence to treatment right now for majority of CF patients and their families. So that really relates to if there's a low adherence to treatment, then the high cost of treating patients when exacerbations happen is basically absorbed by hospitals and by the society at large. So it's really important to look at these different trends when trying to promote educational opportunities for patients and parents. And just one of the parts that showed in the research that in order to get higher adherence for patients and parents, you have to promote their treatments like the physiotherapy, the vitamin enrichment in their foods as a high necessity belief treatment. So this actually improves the likelihood that the patient, as they grow older, is going to continuously progress with the same treatment and adhere to the treatment they have. And so some implications for nursing policy. Because cystic fibrosis is basically an autosomal recessive disorder, it's something that can be tested genetically, but that has a whole gist of other types of ethical dilemmas that arise from that. So it's really important to communicate with families, especially families within this demographic, that if they're starting families, that it's actually really important to go get tested genetically just to check if there's a higher probability that their child might be predisposed to that. So just in terms of genetic treatments, it's really important to communicate that these treatments are confidential and that you're advocating for these patients that they have autonomy in terms of their genetic information and respecting their confidentiality as well.
And these are our references. Thank you.
Thank you.